Tuberculosis, or TB as it's most commonly known, is one of the most common and dreaded diseases in the country. Not only are thousands of people dying every year, but lakhs of people are suffering because of the resistant strains of TB, which get more and more deadly every day. To tell us more on this, we are lucky to have Dr. Kapil, who is a leading chest and TB specialist in Central and South Mumbai. Good morning. Thank you for taking this time for us in our efforts to spread awareness on antibiotic resistance in our city. So, as a leading TB specialist of this city, have you noticed a perceptible increase in the number of drug-resistant TB strains?
Good morning, everyone. So tuberculosis has always been a part of our respiratory practice. We thought the numbers will go down. The numbers are still there, and definitely in the past few years, there has been a significant increase in drug-resistant TB cases. And when I talk about drug-resistant TB cases, it is just not the pulmonary TB. Even extra-pulmonary TB that we are seeing, like cough, spine, lymph nodes, pleural effusions, the number of drug-resistant cases in them have significantly gone up. Second important thing that we have seen is it was always considered to be a disease of a lower strata of society. But we are seeing TB across all social classes now. There are people who are from extremely rich classes to the lowermost socio-economic strata, and TB doesn't spare anyone.
Thank you. So, what exactly is drug-resistant TB?
So, tuberculosis is caused due to an organism called Mycobacterium tuberculosis, which initially gets treated with 4 primary drugs, that is isoniazid, rifampicin, ethambutol and pyrazinamide. These are the backbone of TB treatment, which is normally treated with drug susceptible TB drugs. But what we have seen is that over the years, the number of patients who were treated with this, they have become resistant to the drugs. So when you are resistant to the main 2 drugs of TB treatment, that is INH and rifampicin, that is isoniazid and rifampicin, it is known as multi-drug resistant TB. If you are resistant to a single drug, then also it is called drug resistant TB, and if it is resistant to more drugs, then you have terminology like XDR TB, total drug resistance, where we have patients who are resistant to all the primary groups of drugs. So the resistance is when a drug doesn't work against the organism, it is called resistance. As the number of drugs go on increasing, it is multi-drug resistance, it is XDR TB, that is extreme drug resistance, and total drug resistance.
So, why and how does drug-resistant TB happen?
So there are 3 aspects for drug resistant TB. One is the patient aspect, one is the doctor's aspect, and one is the system aspect. So when we talk about the patient aspect, most of the patients, once they start taking TB medications, they start getting better. So the first thing that they do is they start skipping their medications. They are better. So after a month or 2, if they are not on a regular follow-up, they will start skipping medications. Sometimes the drug loads are high, so they don't take all the drugs, they skip a drug or 2. Sometimes these drugs do have their own inherent side effects, like gastritis, vomiting. And what patients do is they do not come back to us, and at the same time they just stop the medications or at times go into alternative modes of medical treatment. So these are the commonest things that we see from the patient aspect, that is non-compliance. From doctor's aspect, the other thing is that anyone and everyone is treating tuberculosis. So sometimes the drugs which are given are not given for an adequate period of time. Where we say adequate duration of time is a minimum 6 months therapy. Just because the patient is getting better or he doesn't want, you cannot stop the therapy midway. There are certain cases where you require to continue the therapy for 9 months, 12 months. So that is inadequate treatment. Second is inadequate dosages. Sometimes people are given medications which is not as per their weight. So when you are taking a TB drug which is not at the right dose, the subtherapeutic level of drugs can promote further drug resistance. Third is starting of TB drugs for each and every person without proving it to be tuberculosis. So what it does is sometimes you start TB drugs for people who do not have TB. It creates side effects to the drugs and also predisposes them to be exposed to TB drugs. So next time if they really get TB, then they will become resistant. There are certain drugs like quinolones, that is drug comprising of ciprofloxacin, levofloxacin, moxifloxacin, which are an important aspect of MDR TB regime. And when in the community these drugs are written for every single infection, so then it starts a pattern of resistance to those drugs. So from the doctor's aspect, starting of AKT in inadequate dosages, inadequate duration of time, and inadequate and stopping medications when you don't really need to. And sometimes people don't respond to a medication where we suspect a possibility of clinical drug resistance. So what happens is a single drug is added. So ideally, if you are suspecting a drug resistant TB case, then you need to add minimum 3 medications. And the system aspect is that sometimes it's one size fits all, which is not true, because in TB it's a completely tailor-made medication. So sometimes some people don't have access to TB medications. Some people don't want to go to a TB center because of the stigma which is associated of visiting a TB center. Sometimes the quality of drugs can be a compromise, but right now the National Tuberculosis Program is doing a great job. So with the newer drugs, it is very aggressive. So it's a mix and match of a patient, doctor, as well as the system. So anything goes wrong, it increases drug resistance.
Thank you. So if this continues and this goes on like rampaging, then what would be the impact on the community?
So tuberculosis is a highly infectious disease. It is a communicable disease and it spreads through respiratory droplets. So what happens is, and sometimes it may not really spread like the flu. Like I got flu, I sneezed in front of you and you get the flu. But in tuberculosis, the bacilli can enter into your body and can remain dormant. And whenever your system immunity goes down, which could be due to poor intake of food, inadequate sleep, not taking in enough of protein, too much of stress, too much of vices like smoking, alcohol, tobacco. So, or you have an immunocompromising condition like diabetes, or it could be some renal transplant, malignancies, chemotherapies. Then your immunity, the moment it goes down, then this bacilli can get reactivated and manifest the disease. So it can happen, and the problem is we are a very crowded country. If you see the number of people sandwiched in a train, bus, or anywhere else, no one really follows the proper protocol. So ideally, any patient having tuberculosis, especially pulmonary tuberculosis, should be wearing a mask at all points of time. Second thing what happens is that most of these people stay in very small houses, 300, 400 square feet houses. So at one point of time, everyone in the house is exposed to the bacilli because they have a practical problem where they cannot stay in separate rooms. So if this is not controlled, adequately treated, then the numbers are going to go disproportionately high, and treatment of MDR TB is very complicated, very complex, and very difficult. If not properly handled, the chances of mortality also significantly go up.
Right. So what can be done to halt or slow the burning problem of resistant TB that we Indians are facing today?
So most important is creating awareness that there is tuberculosis which is existing in the community, and it can affect each and every person. So it can hamper anyone across the class. Second is that if you have tuberculosis, then don't be inhibited about starting TB treatment. It is not a stigma. And most of the time your details are never shared by your doctor to anyone else. Even the system doesn't share your data with someone else. So at least you need to start the TB medications. If you diagnosed to have TB, please continue your TB medication in the exact dosages, exact duration of time that your doctor has advised. He is the best judge for your TB medications. If you are not tolerating your TB medications, you are having any side effects, please visit your doctor again or the system from which you are taking TB medications. The treatment of drug resistant TB is long, It has a lot of obstacles, hurdles, complications. It is almost for 2 years. There are newer drugs which are available like bedaquiline, delamanid, maybe more drugs are on the anvil. There are plans to maybe shorten the duration regime. But the most important thing is once your disease is identified, you need to be compliant with the treatment. You need to take it for total duration of time. Side effects can be handled by the doctor. And as for the doctors, it is important that in our country, we have to keep an eye open for tuberculosis. We cannot shut our eye saying this person cannot have tuberculosis. So most of us clinicians, if your patient is not getting better, we always think about it. Get the appropriate testing. Microbiological evidence becomes very important in this world of drug-resistant TB. For a doctor and for the patient, important is if you have been suspected to have tuberculosis, at least try to reach to the root of what kind of TB it is. If it is a pulmonary TB, you have tests like sputum examination. If sputum is not producible, bronchoscopies can be done. If you have a lymph nodes can be excised, sent for culture. If you have fluid in the pleura, that can be excised. So ideally, a histopathological or a microbiological, the microbiological evidence is the gold standard in diagnosis of TB and treating, because we don't have to just start TB medication, we have to identify drug-resistant TB as well.
Right. So lastly, what do you think we as students can do to help support this issue?
So I guess as students, creating an awareness across the society in whatever way you can about tuberculosis. One, it can happen. It is completely curable if you take the medications at the right time as prescribed by your doctors. There is no stigma associated with the disease because it can happen to anyone and everyone at any point of time. The only way you can prevent this disorder is to boost up your immunity. So the message is that you should be eating well, high protein stuff. Most of the time, people are eating, but they're eating just a lot of junk and a lot of carbs. So you need to have a good intake of proteins in your diet. You have to sleep adequately. You have to exercise well. You have to avoid unnecessary stresses, vices like vaping, smoking, tobacco, alcohol, all suppress your immunity. And I guess in the rich, the problem is everyone wants to hide it and not accept. So there's a phase of denial. And in poor, the thing is they have a problem of overcrowding, poor nutrition. So we have to emphasize in this class that along with tuberculosis medications, they need to take a high protein diet, and how they can prevent the spread of the disease from one person to another by wearing a mask. Normally, if you're going into a crowded place, I know this is going to be a very bold statement, but if you are entering into a public space, I guess wearing a mask is the only protection. Like as a physician, I see tuberculosis on a day-to-day basis. So my only source of protection is maintaining adequate distance from the patients, wearing a mask, and maintaining my exercise regime and my diet regime. So the important thing is creating awareness across all classes about this, saying that it is completely treatable and how they should boost up their immunity.
Okay, thank you so much for taking time out to talk to us. It was really helpful.
Thank you.